You are listening to a recording from the 2021 PM&R Scholars Virtual Residency Fair. We would like to take a moment to thank the residency programs who have taken the time to present at our fair this year. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap, the best resource for your physiatry clinical preparation, audition rotations, board preparation, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and even oral board cases. Head to pmnrrecap.com to learn more.
Zach, take us away.
Great,
Hey,
you can see
everyone.
it.
All right, I'm Zach McKinney. Like Eric said, I'm one of the third-year PM&R residents from Carolinas Rehab. Just going to start with a brief overview of kind of our program here and a little overview of the presentation. We'll start off by introducing some of our faculty, leadership, administration. Then we'll go into a brief curriculum breakdown. We won't get into too far into the weeds with that, just kind of a breakdown per PGY year, kind of what to expect. And then Eric will take over kind of in the latter half of the presentation, talking about some of the academic highlights and why Charlotte. So our current residency program, we have 5 residents per class per year. And then just this year, we upgraded to 2 categorical PGY1 positions. Traditionally in the past, we had 1, 2 this year. And then it's actually pretty unique that 4 of our PGY1 candidates are actually doing their intern year at Carolinas Medical Center this year. So we have 2 categorical and 2 advanced for a total of 4. We also have a brain injury fellowship. So we have a brain injury fellow working with us this year on our TBI rotation. And then we're also starting up a cancer rehab fellowship. So some of our administration, core faculty, and leadership. Start with the top left here. It's Dr. William Bachnick, pretty big name in the field. He's been around for years. He's very involved in our education, very passionate about what he does and likes to work with us residents pretty intensely. So we'll spend some time with him in the clinic. We do EMGs with him. We get a lot of lectures from him. He's a great resource for us. Then moving down, we have Dr. Vu Nguyen. He is our program director currently, also been doing this for, I think, 10 to 20 years. Very passionate about what he does and loves to build relationships with the residents and really kind of foster what their interests and passions are and help them work towards that. Another great resource. Beneath that, we have Dr. Matthew Schall, who is our associate program director. He also runs our stroke rotation at one of our rehab hospitals that we spend time with. So spend some time with him during that. And then he kind of takes the realm for PGY2s. He's kind of your mentor that you'll meet with like halfway through the year and at the end of the year to kind of talk about how things are going and tell you how you're doing. And then on the right side of the screen at the top, we have Dr. Kelly Crawford. She's the director of our traumatic brain injury program. So you'll spend some time with her when you rotate through TBI. Then we have Dr. Terrence Pugh, director of our cancer rehab program. So you'll spend some time with him during 4th year on your cancer rehab rotation. And then lastly, we have Dr. LaTanya Lofton, who is the director of spinal cord injury program. So you'll also spend some time rotating with her on your SCI rotation. So just to break down some of the curriculum, starting with the PGY2 year, we have a picture of our current PGY2 residents. We like to think we're a pretty social residency program. Charlotte's a great city for that. A lot of breweries, a lot of restaurants, and a lot of things to do to hang out with fellow residents. Just to get into the curriculum, you start off your PGY2 year with a very inpatient heavy year. So you'll have at least 6 months of inpatient rotations. And for each of our inpatient rotations, we do 2 months at a time. And that's just to allow for continuity of care for the patients and so that you can really get a deep dive into that specific subject matter. So you'll traditionally spend 2 months on TBI, 2 months on CVA, and 2 months on spinal cord. And then some interesting things about our program, you also spend a month on a pain palliative rotation where you get to spend some time rotating with inpatient palliative care doctors, getting some experience, with those tough conversations with the patients that they help manage, and also coming up with, opioid care plans, which is a very important part of our specialty and can be. Then we also have a lot of EMG experience. We have Dr. Alexander, who runs the majority of our EMG rotation, who's been doing this for probably 20 to 25 years. He's very good at EMGs, so we get to see a lot of, very complex EMGs, and you feel very confident and comfortable doing them by the end of your rotations working with him. You get to see a lot of stuff like brachial plexus clinics, all the way down to just routine carpal tunnel screens. And then something that's pretty unique about our program, we also spend 4 to 6 weeks at the VA between on your PGY 2 year and PGY 3 year, and then a few more weeks your PGY 4 year. And the VA rotation is pretty interesting. We have a couple locations that we rotate at, a couple VA locations, and it's very outpatient based. So we get to do a lot of clinic time there, where we see a lot of, musculoskeletal patients, get to do some injections and really work on our musculoskeletal and neuro exams. And we also get to do some other unique things, like 1 month working with prosthetics and orthotics, where we get to rotate around the local Charlotte prosthetics and orthotics offices like Hanger, get to see how, the prosthetics are made and work with the amputees, and then actually see them on the other side, like when they come to visit us in clinic. Pretty all-encompassing and a very unique rotation. Then we also spend 1 month working on consults at Carolinas Medical Center, where we're working on a consult service, consulted on patients from anywhere from debility to traumatic brain injury, spinal cord injury, standard rehab diagnoses. And then PGY 3 year, you still get to do some inpatient rotations, but it's more geared towards outpatient. So you'll get to do 2 months of inpatient pediatrics. Something unique about that, we have Levine Children's Hospital, which is attached right to Carolinas Medical Center. So you get to rotate through their pediatric rehab center for 2 months, working with Dr. Sy and Dr. M. Get a lot of good experience and exposure there. And you also get some clinic time with them as well, seeing patients with CP, doing Botox, things like that. You start off your PGY 3 year doing a 1 month inpatient rotation as a junior supervisor. So you get to kind of mentor and coach the incoming PGY 2s on whatever inpatient rotation you started off with. So it's a really good way to start as a PGY 2, because you have that mentorship above you and help you get to learn the new system and really bring you up to speed for an entire month. The rest of the PGY 3 year, we continue to do kind of some repeat rotations like consults, some further EMG work. We get to start working in the clinic that year, seeing clinic patients from a rehab perspective, more time at the VA. And then we also get a little bit more freedom this year, where we get to do like 1 month of an elective and kind of whatever we're interested in. And you really get to design that however you want to, working with whatever attendings you want to, really to fit what you're interested in and your passions. And then another interesting thing, we get to spend 2 months doing MSK work, doing, like interventional spine, outpatient diagnostic ultrasound, things like that. And then PGY 4 year, kind of like I said earlier, you get to do a inpatient oncology rotation for 1 month working with Dr. Pugh. And you get a lot of freedom and time in terms of your rotations this year. You get 1 month of a senior selective, where you get to do another inpatient rotation of your choosing to kind of work on whatever skills you want to work on prior to graduating. You spend a little bit more time with the VA. You get 2 more electives to do things that you're passionate in and pursue further, more clinic time, more EMG, and then kind of like round out your whole PM&R education. You get to spend some time working with physical therapists, occupational therapists, spend a month on sports medicine, and then some more time on consults as well. So I'll hand it over to Eric here, our academic chief, to talk more about academics.
Yeah, thanks, Zach. And feel free to drop some questions in the chat along the way as we're going here. Zach may get a chance to answer them, and then we'll stop at the end as well for them. Kind of continuing on here, a lot of that curriculum stuff is very boilerplatey, as you'll come to find. A lot of that stuff is pretty similar across the board. And so some of the academic stuff we get to do along the way, I think is kind of what helps us make us feel unique, and kind of what we love the most about our program. The first thing is our ultrasound curriculum. We actually have our own ultrasound machine that just hangs out in our call room that we get to use kind of whenever you've got some free downtime on your rotations, or for our specific ultrasound design workshops, where we take a whole kind of half day to work on just the hip joint or shoulder, knee. We kind of go through methodically the curriculum, and then bring in some of our musculoskeletal attendings to kind of show us some of the ropes on some of the new tricks and trades and different things. Our resiliency curriculum has also been something that we've worked really hard to stand up, especially as fourth year residents, to make sure we're taking that time to address the causes of burnout and what we may be able to do to prevent it a little bit more. We've started a Mindful Monday program to kind of work on just kind of mindset and how to improve each and every day. And then we also have our Thursday workout program, which is a fan favorite of everyone taking 7 minutes out of your day. It's resident led, faculty led. Our secretaries even get involved sometimes of leading the workouts. So we have our whole department doing squats and box jumps and different things as we're on the outside parking lot looking like maniacs in front of our patients. We also have fluoroscopy workshops with some of our attendings as well that we can actually, which is a pretty unique thing, we're actually able to get cadaver spines to work on practicing kind of some interventional facet joint injections or transforaminal epidural steroid injections as well, that we really get some more hands-on experience before we start touching patients. And the way our academic curriculum kind of breaks down, we do our rotation or our academic calendar on an 18-month schedule. So everyone gets to do or hear all the lectures twice. And most importantly, I think at least our third and fourth year or second year residents as well, on Thursdays and Fridays, they are the ones that are leading the lectures. So it gives a chance for a little more casual feedback and a little more opportunity for discussion on different lectures. Our diversity and inclusion group is also a huge focus these past several years now, with Dr. Pugh being our physician champion on that. And residents are welcome in this group as well, to kind of focus on making sure that our diversity and our inclusion represents that our staff and our faculty represent the community that we're serving, and making sure that we're meeting those marks that we set for ourselves that are maybe above and beyond what may be expected. Another thing I like about our program is that despite the fact that we're not really tied in with an academic setting yet to this point, we have a tremendous research department with Dr. Newman and Dr. Hirsch that really provide us a lot of great leadership and mentorship to get involved. But another thing that is nice is that research is not a requirement at our program. It just so happens that a lot of residents get into case reports and different posters and design projects that they end up just kind of falling in love with themselves. But that the research is there as much as you want it to be there. So if you want to go all into it, we've definitely got the resources for that. But if it's something that's maybe not your cup of tea or something that you're not really interested in, that's fine. You're not going to be pressured into doing it. And so I think it's a good balance of that. And the way we're able to kind of have that interdepartmental leadership, we have so many different councils and staff we're allowed to be on, both as a department and then as being attached with Carolinas Medical Center, Atrium Health as a whole. A lot of us are on different councils and different committees that represent the whole hospital to allow us to kind of have our voices heard from a rehab perspective, and also hear kind of how the bigger system works within it. Another one of our favorites too is the Special Olympics Med Fest. Unfortunately, that's been on hold the past year with COVID, but we do the physicals for all our Special Olympic athletes in the fall and in the spring. We get a protected day off to go usually to an auditorium or a campus to do all of the routine physical screenings for the Special Olympic athletes. And it's a really fun way to spend some time with some of the athletes, and then also with the residents themselves. Hopefully this fall we can trend towards bringing that back, but that's still TBD, but something that we're still very involved with. I think the other question too is why Charlotte, why Carolinas Rehab, why us? I think just from the start for our region, we definitely have the highest complexity of spinal cord injuries, traumatic brain injuries, stroke, cancer patients, med surg, anything you can think of. We're the Charlotte's only level 1 trauma center. So everything comes to us in one of the biggest catchment areas in the region. Just in the past few months alone, I've admitted patients from South Carolina and Georgia, Virginia, Tennessee. We've had folks even somehow fly all the way over from Colorado to be closer to their family here. So we definitely get the toughest patients possible for our region, which is really helpful as residents to get that exposure. The CARF accreditations, we've got 12 CARF accredited programs across CR as a whole. And we also were the first CARF accredited cancer rehab in the world, which is a pretty cool thing to hear. Another nice thing that I think has been very helpful for me, especially, is we do have a hospitalist for every single one of our patients across all the sites, which is very nice when we get a chance, especially as a PGY2 resident, when you're just trying to get settled in. You have that backstop of having a physician there just to handle the medical issues and lets you just focus on rehab. That also kind of
about 5 minutes, just to let you know.
Thanks, Jim. We also have a hospitalist for our home call as well. So the nice part about being on call at home is that even if there are kind of medicine issues popping up, we do have hospitalist coverage overnight that helps us kind of sort all those things out. We do also have awesome moonlighting opportunities. I love our moonlighting schedule the way it is. We just are handling admissions that come after hours, which takes the burden off of the on-call resident and the primary team itself. And you can start moonlighting after your second month here. So as soon as you basically come affiliated with us, you're able to start moonlighting. We also have a great 401k match and HSA, free parking and free meals, which is very helpful. And I think our COVID response, with the way the department really protected us during that first wave of COVID, and even still, unfortunately, going today, our department's really looked out for us to make sure that we're still staying in the rehab realm of things, making sure that we're still focused on doing the most for our rehab patients and making sure that we don't get pulled, and making sure that we're still doing okay, and that they take the time to talk to us and make sure that we're at least being heard with some of the problems that we may be facing, just given how crazy everything is, especially in this virtual setting now. What's coming up next now? We do have a cancer rehab fellowship that's starting in July of this upcoming year. Our new rehab hospital there is that picture that's being built right now. When you see our Instagram takeover, we may be able to take you in a little bit more to see how it's coming. And also, Atrium's just recently acquired or starting to partner with Wake Forest. So that partnership is kind of blossoming each and every month. So we'll see how that ends up facing out. Those are just some pictures of our class having fun. What comes next? This is where to follow us on our Twitter, our Instagram. We've got a couple virtual residency fair events coming up in the next couple of weeks here. And we're also going to do some open houses, but we're going to leave some time for questions now. If there's anything, either shouting them out or taking a look in the chat here. Let's see. The first one I see here is, do you require a PM&R rotation order to be considered for an interview and matching in a position? I think it helps just from understanding a little bit more about PM&R and knowing what you want to do. But matching into a position, I think it'd be best to rotate and kind of get some experience for sure. Do we offer observerships? I would encourage you to reach out to Sandra Watson, our program coordinator. She's definitely the one to coordinate that right now. It's kind of hectic with COVID, but we hope to have some more there. Are opportunities available for residents to utilize OMT? That's definitely more of a self-directed thing, I would say. Our faculty, if you're comfortable with it and you can propose a safe method to it, I don't think a lot of our faculty would necessarily say no. Zach, what's your favorite aspect about the program?
I would say favorite aspect is just the co-residence. That was one of the things I really liked when I interviewed down here. Just kind of the feeling of kind of like a family. Everybody really hangs out. I feel like we're a very social program. I know Eric and I were both hanging out independently with other residents today and yesterday. So you really get to build like a family-like atmosphere down here. Very supportive.
Yeah, definitely. And that kind of parlays into my favorite part about living in Charlotte is, the diversity we have in this program. We have a lot of people from the Midwest, a lot of people from the South, people from California, New York. We all kind of come together to North Charlotte. My favorite part about living in Charlotte is that I'm 2 hours from the mountains and 3 hours to the beach. The 4 seasons here are pretty mild and in a pretty nice way. I'm from Ohio originally, so I wanted to escape the winter. So I appreciate that. And the fact that, kind of parlaying into that other question, how far do residents typically live? I live about 2 miles away from the hospital, but I'm also kind of a mile from uptown. So it's a nice blend of being in the city, but also being in the areas where there's a lot going on. I think we've got 63 breweries in the city of Charlotte now. So definitely plenty of things to keep you busy and plenty of awesome restaurants to try, especially as things are opening back up again.
Just about a minute left.
Awesome. And then, do you need a 1 year of prelim before going to the specialty itself? So I did preliminary medicine year. That's kind of the standard, is preliminary medicine, transitional year, I guess prelim surgery if you desire that. And because our 2 categorical positions are with the internal medicine program itself. So you're gonna be mainly doing a medicine rotation with or medicine year with them. So Zach and I will stick around for a little bit here. If you want to ask us a question directly in the chat, you can always search our names, Eric Westerbeck and Zach McKinney, and we'll answer them. If not, shoot us a message through Sandra, find us on our Instagram or email or our social media accounts. We're definitely trying to be as accessible as possible. And we look forward to seeing y'all in some of our other virtual fairs where we got a little bit more time to talk.
Thanks so much, everyone. Excellent presentation. Eric, thank you.
Yeah, thank you.